Okay, thank you all for coming. I'm so excited about this talk today. I'm just going to do this live on Facebook too. We have Nick Jukes of InterNICHE. He is the coordinator for InterNICHE, the International Network for Humane Education. Nick has been working internationally for over 30 years to enhance education and training in medicine, veterinary medicine, and biology through replacement of harmful animal use. He has published widely on alternatives and helped establish a range of international resources, including online databases. And Nick has co-organized conferences and performed outreach across the world. And InterNICHE activity has led to widespread direct replacement. Current projects include a documentary film and a book of case studies. Nick, InterNICHE, and its partners have won a number of awards for replacement work. So thank you, Nick, for coming. And again, the instructions are for those who want to get CE credit. I will be putting a survey in the chat. CE credit is only given to those who attend this lecture live. And if you have any questions, you can also email me at info@ronr.org. And if you have any questions during the talk, please post those in the chat and we will address those afterwards. So without further ado, take it away, Nick.
Thank you very much, Crystal, and good morning, good afternoon, and good evening to everyone here today. I'm talking to you from the UK. I know a lot of people at the event, at the seminar, will be from the US, but I think we also have some others from around the world. So good to be here. Thank you for the invitation. I'm going to be addressing alternatives to harmful animal use, humane innovations within the veterinary medical education field. I'm going to begin with looking at some of the background to give a context, looking at some definitions, exploring what is education, what is harm, where animals might be used harmfully or not within education. And then we'll be looking at the broader range of alternatives to harmful animal use, watching a clip of 20 minutes from our new veterinary education film, an episode on advanced surgical training, finishing off with the rest of the types of alternatives that have been developed and implemented by many teachers across the world, and then looking at the broader impact of alternatives, the resources that InterNICHE and others can offer for the process of transformation of the curriculum, and then concluding with the summary of the main points, the advantages of alternatives, and what the impact is more broadly. So without any further ado, let me begin first with just a brief look at some of the a few examples of alternatives. This first one is a virtual laboratory in physiology, and this is an example of how multimedia computer simulation can be used to support the learning process. The next is a look inside the Sindava canine, so an advanced surgical training mannequin. In this case, a student lab looking at enterotomy, resection, and anastomosis. Then we can look at body donation program. This is an example from the Netherlands, a national level program for donating ethically sourced animal cadavers into the education program. So this is also an alternative to harmful animal use, because the animals were not killed for the purpose and had to be put down for medical reasons, for their own benefit. And finally, in this taste of alternatives, just an image of the operating room to remind ourselves that apprenticeship into clinical work and surgical activity is something that is standard within medicine and veterinary medicine, but also can be a replacement to animal experimentation that is sometimes performed within the surgical field. So that's just a few examples of the range of tools, non-animal tools, and work with animals that doesn't involve any harm. So let's begin with the first part, the context and the definitions. Harmful animal use can be found in a number of different fields. Education and training, the focus today, research, and testing. Education and training is a unique field, different to the others, because it's not research and it doesn't involve the acquisition of new knowledge. It looks at known knowledge and how to gain that effectively as a student. Nor is it testing of drugs and chemicals, other materials within applied research or for regulatory purposes. However, I think humane education and training is a prerequisite for humane research and testing. It gives an opportunity for students to become familiar with the range of alternatives that exist. And also, as I'll be arguing, it's about enhancing education and training, enhancing the acquisition of anatomical and physiological knowledge, clinical and surgical skills, but also more broadly, critical thinking skills and emotional and ethical literacy. So I think it's very important that students do use humane, innovative tools, and we can look at the impact of that, not just within education itself, but also within the professions. And that includes humane research and testing, a very rapidly growing field. Also, of course, education is not just for university. It is also something that continues throughout someone's career. So continuing education is an aspect here as well. Now, there's three areas for education and training. The first is education and training at the secondary level, higher education, and the professional level through the use of alternatives. So within the classroom, within the training centre. And this is what we're focusing on today. There is also training in alternatives for application in research and testing. And there's a lot of organisations and bodies that are training scientists and technicians and assessors in non-animal methods, new approach methodologies for use within science. And then there's education about alternatives for students at any level and for those within broader society. So these are the three areas we can look at education and training where it exists. But I think what we're going to be looking at today, the education and training at secondary, higher and professional levels, is also a very important area because it helps set the scene for future careers, because it's often the place where students will be making decisions on what they'll be doing later. Often education is confused with education about alternatives. So our focus, and it's important, I think, to stress this, is it's education and training through the use of alternatives. So let's look at these three areas in a bit more detail. Education and training of students and trainees within secondary, higher and professional levels through the use of alternatives in order to gain knowledge, skills and attitudes, the focus of today. So alternatives are the tools for the process of education. It's a pedagogical issue we're talking about. It's not really science. It might be a science subject, but it's how you learn and what you learn. And it's also about technical skills, such as clinical and surgical skills. And replacement can be achieved through the implementation of these humane, innovative tools. This also includes the special case of laboratory animal science and the use of non-animal models for training in laboratory animal science for research and testing. This is very much about technical skills. Partial replacement within the training might be achieved, but the subsequent animal experimentation in research and testing is in effect endorsed and not challenged. So we don't focus so much on this area, but it's worth noting that replacement within the training aspect can still be achieved with non-animal methods. And it also exposes those trainees to alternatives. And of course, there are a number of other career opportunities open to every one of those trainees. So the second area, training of scientists and others in the use of alternatives for application in research and testing. This is more about science and technical skills. It can bring about imminent or future replacement. And thirdly, education of students and the public about alternatives, typically alternatives within research and testing. This is more of an informational issue, and no direct replacement is achieved. So if we look at the focus for today, we're not going to look at secondary level, but much of what I might say about anatomy is also relevant for the secondary level. The surgical skills, clinical skills and surgery is something for medicine and veterinary medicine only. But the biology aspect, and there is some commonality between secondary and higher education. So within these areas, we generally have 3 faculties: veterinary, medical, and biology. There's also sometimes some harmful animal use within psychology and within dentistry as well. But these are the main areas. And within those faculties, we have the different disciplines: anatomy, physiology, surgery, for example. Within each of those disciplines, you have the individual courses with practical classes or training events. And it's here where decisions are made for which tool or which approach could be used within those classes. Now, the majority of conventional animal use has indeed been harmful. It involves, or has involved, dissection of purpose-killed animals, animal experimentation itself, and other instrumental animal use, using animals as tools, which fits into neither of these categories. For example, giving injections, taking blood. It's also worth remembering, excuse me, that there are also humane traditions. Not everything is a problem that we need to change. Sometimes there are positive traditions that are already humane. And this might be by individual country, by, to some degree, discipline, or individual practical class. So, for example, veterinary surgery in the UK, where I am based, is generally learned with non-animal methods and clinical learning opportunities with animal patients. That's the tradition. It's a humane tradition and it's a positive tradition. That doesn't mean that any of that practice can't be further enhanced with additional non-animal tools, extended opportunities to help animal patients and so on, or innovative tools such as virtual reality. But it's important to recognize there are positive traditions too. And there's also a lot of replacement going on at the moment, I think, as teachers realize the potential of technology to support the learning process. This was something really that began in a large way in the early 90s, even the very late 80s, at the beginning of computer software being applied to education, and people realizing actually you could really have that technology supporting the learning process. At the same time, a lot of students were beginning to question conventional practice. There was a growing environmental and animal protection movement, I think, internationally. And a lot of students began to conscientiously object, sometimes whole classes, otherwise individuals and small groups. But replacement started to happen as a response to that and the realization that technology can further support the learning process. I think also as teachers realized they had growing class sizes with associated challenges, the use of software and other tools could actually help manage that. And as teachers also thought about teaching objectives more, started to audit the courses, the combination of tools, including new tools that have been developed, were recognized as ways of better meeting teaching objectives and often saving money too. So the pedagogical issue, I think, has always been the strongest aspect feeding into the process of change. But there are many different ways of looking at this and dynamics there, that when we weigh them all up, we can see that everything has a role in the process. So there's very positive change going on in education. I think there's also the beginning of more change within testing too, and some within research. So I think it's quite a positive time at the moment. How do we define humane education and training? Well, it involves curricular design that enables teaching objectives to be met using humane alternative methods. Animals would be free from harm, and students and trainees have freedom of conscience. And it helps develop the qualities and the skills of critical thinking, emotional and ethical literacy or awareness and skills, and the sense of responsibility. If we talk about replacement of harmful animal use, we of course need to define harm, and we define it as any action that denies or limits the following freedoms. The freedom to live, because taking a life is a significant form of harm. In our opinion, the animal can no longer live, can no longer connect with his or her family and extended species connections and its his or her local ecology, and no opportunities for pleasure. So freedom to live, I think, is very important. And however humane the killing is, that was a quote marks around that word if you couldn't see, then we can still say that freedom to live has been removed. So that is a significant form of harm. Similarly, freedom from pain, injury, and disease. And the full definition of harm, according to us, is at our policy, which you can find at our website, interniche.org. And this is quite a thorough policy. And when you read it, you might wonder, how can we possibly defend all those freedoms? But in fact, the examples that we can find of humane, innovative tools and approaches developed and implemented by teachers, often with pressure from students and society, as well as the technological opportunities, the material science opportunities that allow those developments to take place. We can see that there are examples, case studies from all across the world covering all of the practical classes that exist within veterinary medicine and other faculties as well. So I think it's feasible and certainly desirable to think about meeting all of these freedoms, and some of the examples I'll give today show how this has already been done. But harm goes beyond what actually happens within the practical class. When you look at the whole picture, the whole life cycle, we can see that there is harm and a negative ecological impact from the capture of wild animals, which happens for some courses, the breeding, the transportation, the caging and keeping, the experimentation and killing itself, preservation, and also the disposal of, for example, an animal cadaver. So the broader issues are quite serious, and the many aspects of harm and negative ecological impact are something that we need to bear in mind. Now, increasingly, university courses are adding individual classes about ethics, about alternatives, and the 3 R's of replacement, reduction, and refinement, and animal welfare. And this is always very, very important. Of course, the quality of the course can be always be enhanced, but when that sort of course happens alongside harmful animal use, I think we have some challenges. So teaching about these issues whilst also having harmful animal use within the same department or the same faculty is inconsistent. And I think the lessons, the potentially very positive lessons of learning about animal ethics, for example, might be negated by that harmful animal use. So I think the replacement alternatives is actually a significant aspect of that education put into practice. And these approaches and these classes need to be done in parallel. They'd be synergistic as well. It's not just about avoiding problems. You can also go beyond what each individual lesson and tools potential can provide. So the 3 R's, which is talked about a lot, but increasingly being replaced by some other terms. The 3 R's are replacement, reduction, and refinement. And we can ask whether these are helpful or indeed relevant for education and training. In our opinion, they have limited relevance because the 3 R's derive from a laboratory animal science perspective rather than a pedagogical one. And we're talking about pedagogics, we're talking about didactics, we're talking about education and training. Still, even within the 3 R's, replacement is indeed prioritized, according to Russell and Birch, who wrote the Principles of Experimental Technique, and is the objective within the 3 R's. Often people are focusing very much on reduction and refinement, and replacement sometimes seems to be somewhat forgotten, but in fact it is the aim. So I think we can redefine the 3 R's for education to make it stricter, because full replacement is feasible in education and training. We can talk about 1 R, not 3 R's. We can also redefine to make the definition of alternatives smarter. Replacement solutions might indeed involve animals. They would need to be still fully humane, but they add 0 additional harm. And we can also think about retirement of the 3 R's and instead focus on enhanced education, just as within research and testing, new approach methodologies, NAMs, are being very widely discussed. And this is a term often replacing the 3 R's now in terms of what better ways of predicting toxicity, for example, within drug development and testing. Now, I think it's also important within this area to look at some of the myths that exist within the field of education and indeed science. And one of these myths is what we can call the real thing. Animal experimentation as the real thing. This is the myth. And alternatives are not the real thing. However, I think this confuses the method with the objective. Animal experimentation is just one method, just one tool, just one approach. The real thing is effective gaining of knowledge and skills and positive attitudes and values. We'll have a look at another myth a little later. So the key points from this section of the presentation today is that it's a matter of curricular design, of teaching, of defining teaching objectives, and the choice of tools and approach that can enhance the acquisition of knowledge and skills and attitudes. Now let's have a look at the different types of alternative. We need to define alternatives, and we define them as educational tools or teaching approaches that can replace harmful animal use and meet teaching objectives. And in many departments, I think we need to remember that alternatives are now the norm. The word alternatives is often no longer used because these are standard ways of teaching that have enhanced the quality of the education. We can look at non-animal tools, which is what most people think of as alternatives, but in fact, it's just one of 2 methods. The second is those fully humane approaches that involve animals. They're either ethically neutral or they are beneficial to individual animals. And we'll be looking at these under the different types of alternative. So the different types are film and video, computer simulation and augmented and virtual reality, ethically sourced animal cadavers, organs and tissue, models, mannequins and simulators, clinics with animal patients and animal volunteers, student self-experimentation, in vitro laboratories, and ethical field studies. And we're going to have a look at each of these in turn. And in the middle, I'll be showing you the film episode summary with a focus on advanced canine surgery. So film and video, this typically involves a professionally performed dissection, but could also be a film of an animal experiment or other procedures, even film of operations that students can watch later, or could even watch live in some cases, work with patients, that is. But what's important about this is that often it's a professionally performed dissection, a professionally performed procedure. And that can often impart more knowledge than a dissection done by the student, him or herself. So I think these have great value and are also very flexible when they're digital materials. Of course, film and video is not hands-on, it's passive, but that doesn't matter, because as within all education, a range of tools and approaches and resources are brought together in order to meet teaching objectives. So typically a number of different approaches would be used, and a number of different tools, including alternatives, would be used. And film would be one valuable tool within education, also a valuable tool for replacement of animals purpose killed for dissection. And other tools can provide the hands-on experience within anatomy, within surgery, within other disciplines. Multimedia computer simulation has a number of different aspects. The first is the digital dissection, the on-screen dissection. And here you can see a rat dissection model where you can actually do the dissection online on using the software. Some of them are online. You can do the dissection just as you would do in real life. You have color overlays, you have background information, hyperlinks to further information. You can often have different magnifications and opportunities to compare between species. So this is one type, the simulation of the dissection. Then there is the compilation of images from a dissection, also for anatomy. This is the virtual canine anatomy developed at Colorado State University. And this is also available in its penultimate version for free. This is a collection of very high quality images, not only of dissection, but also radiology. And this particular image is one of 12 images at the different stages of deep dissection of the canine head. And you can see on the image that you have a menu on the left where you can click on individual nerves or muscles and other structures, and they will be highlighted on the image. And you can also click on the image itself, and the label for the structure will appear. At the bottom, you have more information on that structure and hyperlinks to related structures and further information. So what you can see here is dozens of labels and ways of highlighting structures on an image, which is one of multiple images as the dissection goes deeper. This is just the deep dissection. There's also a superficial dissection, and both of those are just of the head. And there's also dissection of other parts of the canine body as well. Dissection itself is only one part as well. You have all the radiology. So it's an incredibly rich resource, just as much of these software learning tools are. And if you were trying to sort of print all that in a color book, it'll be heavy, it'll be expensive, and it doesn't have the interactive element. Here you can go back to different levels of the dissection. You can check and you can check again. You can revise before an exam, as well as having this as an important tool within your within the semester. And you can also use this as within a test as well as a teacher. So the fact that it's so flexible, I think, is also one aspect that shows the power of multimedia. The next The next alternative, the next multimedia alternative, I'll show you another. This is another form where you can look at anatomy, in this case a frog, but you can dissolve away different layers of the body in order to look inside. You can dissolve away the skin, the first set of organs, go deeper and down to the skeleton, and you can bring it back up again as well. So animations like this provide another way of learning anatomy. And this isn't a simulation of dissection, but it is a way of learning anatomy. And I think while there's nothing inherently wrong with simulating dissection or having images of dissection, I think having other tools that use different approaches are also valuable in terms of adding new ways of understanding and examining structure, but also different representations of animals as well. Dissection is a destructive approach. It doesn't mean it's inherently wrong, as I said, and it's certainly necessary within veterinary education, but it doesn't need to involve actual killing of the animal or killing for that purpose. However, even in the simulations, which amongst the different tools that can be used together to learn anatomy very effectively, having animals where you're not using a scalpel and where you can dissolve away in a gentle way and then bring back those structures, I think also gives different messages about the animals through how they're represented, and moves beyond that destructive dissection approach, including the simulation of that destructive dissection approach. Now, we can also look at the next type of multimedia computer simulation. And this is slightly different. This is the virtual laboratory. So while some of those other anatomy softwares are to some degree interactive, the virtual laboratory is often very interactive. And laboratories like this with different apparatus that you can use and set all the different parameters for an experiment are very, very good for physiology and pharmacology, because they allow for you to look at change over time and to correlate multiple and simultaneous events. So very good for these two disciplines, also others to some degree as well, biochemistry, other areas, and so on. But this here is a stills image of sim nerve. In the next shot, you'll see sim muscle, which is related and part of the set of virtual physiology series produced at the Institute of Physiology at Marburg University in Germany. The producers of this software, we know them, and we've helped arrange for this software to be available for free for students. Faculties have to buy them because, of course, there's a lot of time and money investment in making such software, but students can access these for free. What they often are direct simulations of classical experiments like the frog nerve, frog muscle, rat heart experiments. So they are direct copies, but of course they are advantageous in the sense that they don't use those animals harmfully, like in the lab itself, involving killing for making those preparations. But also they give you something else that the animal experiment didn't have. Now, the teacher who developed this, Dr. Hans Braun, he only developed these because all of his class of students refused to do the physiology experiments. They were growing increasingly empowered and decided that technology is or should be good enough to be able to simulate these. And the teacher himself was quite unhappy with that, but he went along with the strike and responded by developing software, which was then went through a number of iterative processes, and students gave feedback to the teachers. And actually, after a year of the students using the softwares, the teacher realized that actually the students were doing a better job with learning physiological principles than they were when they were using animal preparations. And this was because they were more self-directed. They weren't always sort of asking older students or lab assistants or the teacher for for help. They could be more self-directed. They could learn by doing. And of course, software like this means that you can go backwards and forwards until you've really understood the principles, till you believe that, and the teacher can also see that you've understood those principles. The responses from, say, the nerve conduction velocity experiments are rooted in algorithms. So every result is different. So that's good for avoiding copying. It's good for teachers to monitor what the students have done. And it also gives the diversity of responses for students to investigate. Occasionally, the apparatus goes wrong deliberately, because that will happen in the real world too. And that's something that I think students need to experience and learn to cope with too. But in general, this is a way really of mastering your physiological and the pharmacological aspects of physiology knowledge, and to sort of get involved in experiments in a virtual way. So very good software, and very advanced, and even the developer or his high-level colleagues working in the field as researchers will sometimes see a result and get really confused by what it is, and then realizing they just forgotten one very good aspect of the programming that helped give that result, that reflected the physiological situation more closely than actually the animal experiment ever did. Other types of multimedia, we have more animations, as you can see on the left, that are neither anatomy nor physiology, but this is an image taken from the glass horse equine colic, and it shows you not only the anatomical structures but also how individual conditions arise. So it's very good for visualizing structural relationship and the development of conditions and disease. The same software also has examinations, so you can actually visualize doing, say, a rectal exam on a horse and identifying a distended colon and understanding how that might be an indicator for a certain condition. So these are very good for being able to visualize and understand, both for diagnosis but also for treatment. And of course, with software like this, you can rotate, you can spin, you can magnify and go back from the image. So very flexible in terms of being able to understand. On the right, we have just an image from an app. There's a lot of different apps in medicine, in biology, and in veterinary medicine. So you can just have a quick reminder of certain procedures and how to do them throughout your course, and also in preparation for tests. At the more advanced level of software, and often the basic levels are absolutely sufficient, and the basic levels of fidelity of the software and complexity of the software is sufficient for what you're trying to learn. But at the more advanced end, which usually involves more money, but as with all hardware and software, the prices are generally going down after the initial development costs have been recouped. And augmented reality is a very good way of incorporating both the virtual aspect and the real objects. And virtual reality itself is a very immersive and effective way of being able to focus in on a specific procedure or a specific skill, as you can see here in the images. So on the left, we have the goggles that the students and trainees are using in order to look at anatomy. And on the right, we have the haptic cow developed in the UK, which is a combination of virtual reality with mannequin. So you can put your hand in and you can actually feel the ovaries, and you can judge the level of pregnancy and so on, other aspects too. So there's a haptic cow, there's the haptic horse, and these really, because they're so immersive and because they start to involve more senses than just the eyes, and the sense of touch or haptics is one of those senses that may or may not be part of virtual reality, depending on what the teaching objectives are. They're very sensory, they're very immersive, and they're very good for covering all the bases in terms of putting you in that situation so that you can really gain that skill, understand that procedure, and become proficient. So some very good ways. Of course, they can involve the hands-on aspect when you have hands doing things. Otherwise, it can be something that's more about looking and understanding. Ethically sourced animal cadavers, organs, and tissue are the next type of alternative to look at. Now, virtual reality, software, and so on are really great. They all can play a very important role, but certainly for veterinary students and zoologists, they do need hands-on experience of animals and animal tissue. So what we have to think of is that's an ethical challenge. How can it be met? How can we meet the teaching objectives that involve hands-on experience of animals and animal tissue? And a body donation program is one of those ways. So the image we have here is of a body donation program from the Netherlands. And this is a nationwide program where an animal protection group advertises the program, and private clinics across the country have posters up in their waiting rooms, and clients of those individual clinics can choose to donate the body of their deceased loved companion animal into the program, the educational program, as a way of investing in effective training of student veterinarians and bringing about replacement of killing for anatomy, pathology, and also some degree of clinical skills and surgery training too. So a national level program doing this. There's also some great examples at Tufts University in Boston in the US and elsewhere, but sometimes these are more ad hoc donations, and sometimes formalizing the program can be very effective and can enlarge it, can also recreate very positive links between the public and universities. Sometimes there's mistrust there in terms of animal use, and this is an example of how very professional and ethical ways of using animal bodies can have multiple benefits and re-establish that trust, which I think is very important. Ethically sourced means that the animal was free living and died in an accident or had to be put down for non-recoverable terminal illness or injury. That's our definition within our policy. We also have a separate section where we address acceptable other sources where the animal wasn't free living. For example, certain animals you don't find free living. They're generally work animals or used in other ways. And we have some flexibility there where a veterinary student really does need to experience, say, camel anatomy or equine anatomy, where there may be very few or zero, depending on the country, free living animals. So as long as the death of the animal has also been the same, the animal died in an accident or was put down for medical reasons, then we would accept those as well. They wouldn't be ethically sourced because they weren't free living. That would deny the fully ethical aspect, but we would consider them still to be acceptable for when the student really does need that hands-on experience. Further information is at our policy. You can also preserve such specimens. Some of you may have seen the Body Worlds exhibition, where plastination is used for humans and animals, and these can provide specimens that can last almost forever. Very, very durable specimens, very realistic, of course, because they came from real humans or animals, and very, very good. There's also the El Nadi technique, which is a technique developed by an American Egyptian professor called Dr. Fawzi El Nadi, and you can read about his technique within the journals Altex and Atla. And this is a way of using low-cost approaches to preserve specimens, similar to plastination, but using acetone and ways of drying the specimens in a way that's very suitable worldwide for preserving. And often the specimens are a little bit more flexible than plastination, so they can be used for clinical skills and surgical training even more than plastinated animals. So preservation, I think, is a good thing that we need to bear in mind. You can also perfuse and add pulsation to real animal specimens. Here are some photographs of the method being used at the University of Sao Paulo in Brazil. And we were happy to be able to support the development of this process through a small grant program some years ago. And adding perfusion and pulsation is something that you can also do with humans as well. This is a neurosurgical training area. This is Aboud's living cadaver method. Here you can see Dr. Emad Aboud, an American Syrian neurosurgeon. And here, again, pulsation and perfusion is used to create an animated cadaver, a living cadaver. And you, of course, then you have bleeding, which is very important within surgery to learn how to manage. This is the POP trainer, the pulsating organ perfusion trainer. This is developed by Optimist, the Austrian company, who see that this sort of simulator is now the gold standard for training in laparoscopy. And that field of minimally invasive surgery is very common now within human medicine, and increasingly so within veterinary medicine, and partly because of the reduced trauma to the patient. But in this case here, you have a closed system. Inside you put what we would want to be an ethically sourced animal organ or group of organs. And then it's perfused, and you add pulsation, and then you have the lid and the mat, which reflects or simulates the abdominal wall, and you put in your trocars, your tools, the light and the camera inside, and then, of course, on the monitor, you can be practicing different procedures using different tools. You could use it as a way of testing new tools as well. And I'm sure within 2 or 3 years, 3D printing of organs with multiple layers for vessels will also be good enough to be able to use instead of animal organs in the inside. Often slaughterhouse material is used. In this case, we wouldn't agree with slaughterhouse material because the animals are still being killed when they don't need to be killed. So even though it's waste from the meat industry, it wouldn't fit into our policy. However, we have done a demonstration of the POP training using a donated large dog organ or two, and it can also be used with other animals too. So now we're going to have a little movie break and look at the summary clip, a 20-minute clip of advanced surgery. And it's called Surgery in the Sindava Canine, which is a case study of a very good advanced model, the Sindava Canine. And we're going to be exploring some of the issues concerning skills acquisition and its challenges within a veterinary degree, and looking at this particular tool as a way of helping to better prepare veterinary students so that when they graduate, they've actually had more hands-on experience and are more skilled in terms of their surgical skills, their confidence and their competence. And this clip is a 20-minute summary taken from the full 37-minute episode. And that episode is the first episode to be produced from a film series we're working on called DVM Training the Animal Doctor, which will be following the whole trajectory of a veterinary degree from the preclinical to work with animal patients, with case studies from across the world showing how the alternatives, the humane innovations, can and have already fully replaced the harmful animal use in multiple locations across the world. So enjoy the film, and then I'll be back afterwards continuing with types of alternative.
My name is Dr. Galina Hayes. I'm an assistant professor at Cornell University. I work in the soft tissue surgery section, and my responsibilities include providing service to clients and animals coming to the hospital either on an elective or an emergency basis requiring soft tissue surgical procedures, as well as training the students, both the third and final year students, in the theory and practice of surgery. Veterinarians are expected to know and do a lot and have a grasp of a very wide range of skills, which in my opinion may not be entirely realistic to expect them to accomplish within 4 years. Their exposure to hands-on surgical training may be limited to just a few weeks in their final year of their DVM training. And within those final weeks, there may not be that many opportunities for direct mentorship. In the veterinary world, we leave and are expected to be surgically competent at the end of just our basic DVM training. And while I don't expect that to change anytime soon, I think we can change the way we deliver that training through the DVM program, to try and make sure that the skill set that our graduates are equipped with is a little bit closer to what they're expected to have.
Within the sophomore surgery course, the course that I coordinate, I have tried to focus on clinically important, practical concepts, techniques, knowledge. What are going to make a difference for my patient? For example, GI surgery, very, very commonly performed. Dogs eat rocks and toys and they plug up their guts and they need to have surgery. If you don't do the surgery correctly, there is a good chance they're not going to survive because they're going to leak the contents of their bowel into their abdomen. I'll spend a lot of time talking to them about how do you properly assess the bowel to make sure that you've got healthy tissue that you're bringing together, and how do you suture it together correctly, because you can suture it together incorrectly, spend a lot of time doing it, feel good, and have a failure. I do believe that if you understand the tissue properties and the pathophysiology of the disease, and you have basic surgical skills and common sense, you can apply those basic skills that you learn from your courses and maybe a clinical spay to other procedures.
In my opinion, surgery is a very it's heavy on hand skills, yeah, and you can talk about it in a PowerPoint all you want, but nothing really replaces having someone stood across from you, adjusting how you're holding instruments, adjusting your body position, adjusting your tissue handling, and it's those skills that translate into patient benefit and patient safety.
So here at Syndaver, what we're looking for is to fulfill curriculum need. University of Florida specifically saw the need for an alternative to cadaver surgery. It was not working. And live surgery, too, was something that they did not want to persist with. They had specific curriculum tasks, surgeries that they wanted the students to be able to do that we needed to fulfill in the model.
We set up an interview meeting with them. We drove down to Tampa one day. We pitched an idea to them about using their technologies that they had already, developed and had been marketing and applying on the human side for dogs. From a practical perspective, the vascular anatomy. So how big is the vessel? Where is the vessel? Is it there or not? Does it connect to the right places? With the texture of the organs, are they stiff, too stiff? Are they too friable or too soft? And now we spend a lot of time on them and they're beautiful. The liver is very, very close to the texture, the feel, the compressive abilities, qualities. It's vascularized. We have a little bit vascularized of a dog liver. We've got quite an impressive high fidelity canine now.
So the first thing that I'm proud of and like is the fact that it does have a very realistic airway. The tongue, as well as the internal aspects of the glottis and all, allows intubation. Also, the face, I try to give it kind of kind eyes, and you feel a bit of empathy for the canine as you use it. Second, we do have the ability to put IV in both front legs in the cephalic vein. To that, we can also draw blood from those areas. We have jugular veins. It is modifiable, so it allows central line catheterization, but you can draw blood from both sides. It also is a pulse, and you can create anesthetic scenarios where the learning experience can be beyond just what's being done within the dog. In the real world, you've got to worry about their breathing, you've got to worry about their blood pressure, their heart rate, And the dog, because of our ability to have it kind of change through a tablet, we can alter heart rate. We can put them in ventricular tachycardia. We can modulate them. Looking into the chest cavity, there is a heart, as well as you can see both lungs and the bifurcation of trachea. Since this can be intubated and hooked to a respirator, the lungs will expand, and you can, of course, adjust that to enhance the scenario.
Conceptually, what we do is very simple. We start out with a live tissue study. So we'll actually, get a sample of a tissue. We'll run it through a battery of tests that can be, mechanical, physical. They can be things like, puncture resistance, coefficient of friction, abrasion resistance, tensile modulus, stretching, pushing, pulling, and measuring the kind of loads you get in response. Then using a knowledge of material science, you can come up with candidate materials to try to mimic all of those things. And you might have 12 different properties that you're trying to mimic. And through a process of experimentation and designed experiments, you can come up with a material that would be considered a validated mimic for skeletal muscle, for example. And once you've done that 100 times, you've got, materials that you can build an entire body with.
Certainly, I think one of the greatest strengths of Sindava use is in its ability to provide a very high fidelity environment for the practice of abdominal surgery in dogs. For me, the intestine in the Sindava is the closest to live animal dog intestine that I've been able to find. It has very similar layering, it holds suture in a very similar manner, it handles the same, you can perform the same procedures in it, you're working down within a cavity, it holds staples in the same way that live dog intestine would. We've really tried to focus on two target audiences, if you like, these general practitioners and ER doctors. Probably the highest risk procedures that surgeons in that setting perform are intestinal procedures, and that there's an intentional emphasis on intestinal procedures for those reasons. So the students are assigned in pairs to a cadaver unit, and they each alternate performing different components of the procedure. And then our focus during the lab is to teach them gentle tissue handling, efficiency in their use of instruments, how to maintain a flow of productivity through the procedure and not get bogged down in unnecessary snarls, and safety, and how to maintain a sterile field, how to manipulate tissue so they can maintain good visualization. And it's those core skills which they can then take on and apply to pretty much any other procedure that they try and do in the future, but which are impossible to teach in a didactic setting.
This leads us to the bladder. And of course, the bladder specifically has a few pathologies itself. There are, in this case, 3 stones that are palpable within it. This again guides the surgeon to perceive there to be a problem. There's stones there. He doesn't know how many. So he must open the bladder, remove the stones, but thoroughly pass a catheter, clearing it, and then passing it again.
You can either put your blade upside down, and just like the linea, do the reverse stab incision up, and then extend with a pair of scissors, or you can paint down with the blade until you're in the lumen, and then extend with scissors. But I think either of those are fair.
Ready.
So, when you guys are suturing the bladder, please ensure again you go serosa to mucosa, mucosa to serosa to ensure that you engage the submucosa. Use your needle here to grab the loop. Pull up, right? That's going to tension the previous sutures that you placed, and then pull it down. And as you pull it down, you're going to be able to put it in the position that you want the suture to lay. And then once you're there, try not to move the knot, and then it's another additional 5 throws here, so 3 total square knots. And I like the way you're flattening your hands. Rock your hand and your needle driver in your hand as you go. And so as you rock it, it's going to tighten each side now.
Going further in, we would exteriorize the intestine. And again, as a good surgeon, you are thorough in your exploration and will feel of the intestine and determined that there are certain irregularities here that you don't want to miss. So it feels kind of like a dice. How would I deal with this particular thing? Well, you would do an enterotomy. So at this point, you would cut, remove that foreign material, sew it up. But there's another issue here too. There's a pathology, an area of irregularity, perhaps damage that was done by the dice. So this would guide us to consider this area an area where I would do an anastomosis.
What is going to be the preservation of your blood supply? And this is the hardest portion to figure out, I think, with a resection anastomosis. Twofold is where to cut and what blood supply to save. And so, again, if we're pretending that we need to remove all the sutures of the enterotomy, what arcades need to go and what arcades need to stay? You have great blood supply from this jejunal arcade to supply this from this end. You want to actually pretend like you're placing a suture almost at the base of the intestine and ligating so that it's not bleeding. And it actually is like a very prominent artery that'll spurt at you. And so they can be a pain. So I find trying to create an environment for success before you cut the intestine is important.
So I think surgery is very much an iterative, cumulative acquisition of skills. And when you begin surgery, you don't know how to hold a pair of needle drivers and you don't know how to tie a knot. I mean, it's very appropriate that you learn to do that on a silicone pad. And then the next challenge after that becomes how to adjust that suture tension appropriately to the tissue that it's being placed in. And then a silicone pad no longer works and you need something that simulates tissue. And then the next challenge after that becomes how do I do those things while working down and inside with another piece of bowel, trying to flop on top of the piece of bowel I'm working on. And then to learn that skill set, you need an actual full dog. And then the final part of it becomes how do I learn to do that with a patient that's breathing and moving and bleeding, where I feel the pressure of emotional responsibility to the patient and the owner to perform optimally. And for that, you then need a live patient. And you would never think that your entire surgical training could be accomplished on a silicone pad, but you would never begin with the live patient. For any skill set, there is a learning curve that exists. When you're low on that learning curve, you will have an error rate. And what is important is for that error rate not be transmitted to the patient. Learning in an environment, just in the same way that airline pilots learn in simulators, surgeons need that same opportunity.
So we've designed this so that you have repeatability. The organs that are interfaced are replaceable. Going further back, you can appreciate the stomach and the omentum, which is draping all of the intestine. This is a female dog. It's also designed as a spay trainer. We do have the reproductive tract represented. It also has the suspensory ligaments, the broad ligament. It has the horns, ovary. You would have to approach the abdomen, go in and break down that suspensory ligament, ligate the ovarian vasculature, and then come down, break it down, and remove this as you would a common spay.
I think it's important to recognize that all surgeons, no matter how experienced and how proficient, will run into situations where either they've made an error or just the nature of the procedure that they're working on means that some untoward event begins to occur. Typically, that would be active hemorrhage. It might be loss of control of a ligature. It might be an insecure knot. It might be inadvertently traumatizing crucial tissue. And it's important, in my opinion, that students experience that emotion for the first time in a setting where there is not a live patient at risk and where there is someone available to mentor them through how specifically to address that issue. And so that's a great opportunity to give them their first introduction to that emotion and how to handle it, to perform competently under stress.
We're going to set up a clinical scenario where one of their pedicles secondary to a spay that they've been doing is now bleeding. The patient is starting to decompensate. Their anesthesiologist is panicking in a certain way and kind of set up a high pressure situation for them to try and figure out where the bleeding is and to then stop that bleeding. Because your blood or your heart rate has now come up to 160 beats per minute.
There
So-
must be something bleeding. Okay, I'm gonna check here. Oh, there it is.
And your patient's heart rate is 180 beats per minute.
And this stupid hemostat is not working.
We're up to 200 beats per minute.
Okay, bleeding is under control.
And our heart rate is coming back down slowly here. Once you're done, cut that and release the hemostat and see if it's bleeding.
Not bleeding. They saved us. They saved him.
And so I would say that was really good. You guys identified the major bleeding pedicle. The only thing that I would say, instead of going directly in with a hemostat, right, start with the Balfours, right? Get in, improve your visualization, right? How did you feel as the crisis developed?
I mean, yeah, I do feel like the machine really hyped it up. Made me think something was really dying. But yeah, it was well controlled really quickly, and we were able to visualize everything really quickly. So
I think really the Sindava Lab accomplishes multiple facets or multiple goals. One is to try and remove students' natural fear of surgery. It's very hard to behave with good competency and calmness when you feel stressed or afraid. The second is to encourage an enthusiasm for the procedures and for surgery in general, and encourage them in the idea that your surgical training is an iterative process. You acquire a skill, you practice it, you discover that you need another skill, you go learn it, you practice that. You constantly improve, and that's a lifelong career commitment. And the third is to give them a basic skill set which will translate into any surgical procedure that they undertake.
Well, the most difficult thing about getting something like the synthetic canine into practice is the cost. We have a number of ways we can do to help universities and different places acquire them. It's an investment. It's definitely an investment. The argument that we make, and the argument that's 100% true, is that you get superior training. If you really want to be in the business of graduating students that are going to be able to practice and perform surgery, you're doing them a disservice if you don't, invest in this sort of platform.
For me, performing that kind of surgical training on a live animal, which is being used solely for the purposes of training and is then euthanized, is unacceptable for a large number of reasons, not the least of which that I believe it inculcates in the beginning surgeon the idea that the patient is disposable. I would not be ever willing to participate in a lab like that.
The only use of live animals in the training of surgery at the University of Florida is in our small animal hospital, where we have board certified surgeons who are doing clinical surgeries with our professional veterinary students, either assisting or watching. I am not a believer in terminal surgery. They don't do it in human surgical training, and it's my opinion that it's not something that we need to do in veterinary, and I've always felt that way.
You can learn good medicine and be ethical at the same time. And I believe in the long run, that will translate to being a better, more empathic doctor too, because you won't carry that burden. When I graduated, I did have to experience terminal surgery. In hindsight, I don't feel that that really taught me anything that helped me in the future. In fact, I still carry that scar. But it all circles back to that core necessity on several fronts. One, to preserve our own emotional and ethical kind of compass, as well as to allow us to be better clinicians, to give our clients better service, better medicine. I love caring for animals. I see myself more as a pediatrician than a veterinarian. I see veterinary medicine and the practice of veterinary medicine more about preserving the bond. I feel a great weight of responsibility that the connection between that client and that patient, that's just pure love. People are appreciating this unconditional love that these companions give. It is really, it's a joy for me, actually.
Okay, I won't bore you with all the film credits. You saw the funders, and you can see the rest of it online on our website very soon. So let's continue now with the remaining other types of alternative, the different tools and approaches that have been implemented already in many universities. Models, mannequins, and simulators. You've watched a clip now looking at an advanced high fidelity model. But of course, at the very simple level for anatomical models, such wooden and plastic models have been used for decades, and in some cases hundreds of years in the case of wood and paper mache and other approaches. And these are also very, very good tools, and they'll continue to be used because they have value. This equine model on the left here also has replaceable parts. You can detach them and put them back, and you can look at labeling as well. So there's a lot of different models available. You can also make your own, not only out of standard materials, but you can also build up the anatomy of an animal in model form, such as this image on the right shows, which is a clay-based model. So you have something that's much more creative and slow and involving of the student manually, where you have to build up different muscles, different layers, have them in the right position relative to each other, and in terms of and size and depth and so on. So this is also another very creative way, which I think is of great value. And between software, ready-made models, building your own out of clay, and then of course working with ethically sourced, preserved or fresh cadavers, I think you have multiple angles which are very, very good for covering the different learning styles, but also bringing out the advantages of each type of alternative to benefit each and every student. 3D printing, of course, is a very important area, incredibly fast growing at the moment, with different qualities of material, hard and soft tissue. And there's also 3D bioprinting growing too. So this is an area where we can see the production of synthetic bones, synthetic organs, and so on, locally within a university, and very, very important, I think, in terms of not needing to be shipping things all over the world, to be able to use your own designs, focus on species that might be specific to your country or region. Much education, of course, is by discipline is very similar in veterinary medicine right across the world, but there are sometimes differences with species or a slight change of emphasis within a particular course. So 3D printing really allows for that sort of flexibility to make it sort of locally relevant. Other models might be just something very basic, like a single layer silicone pad, or in this case, a 5-layer pad, where you've also got resting or circulating synthetic blood. And this shows you how you can practice your basic surgical skills on a model of suitable fidelity and complexity. So this Indaba canine we just saw a case study of has multiple functionalities, but is of course advanced and expensive. A very, very valuable tool. But at the basic surgical level, you don't need something so complex. It's a question of sufficient fidelity for the skill set and the specific procedures being performed and learned. So basic models are fine for basic skills. And it is said that you can learn surgical skills, specific surgical skill badly with only 50 tries, but to learn it well, you need 200 goes. And I think that's a good point that needs to be made, that the basic skills, as Dr. Galina Hayes said in the clip, really need to be mastered so that everything else can be done well afterwards. And so that set of skills can be applied in multiple areas in a way that can really mean you master each of those skill sets and procedures and techniques in a very healthy way, a very good way. And you're going to be able to build on those basic skills in an effective way. So I think starting off with your eye-hand coordination, your muscle memory, and getting that right is very important, and basic models are sufficient for that. There are lots of other models, the rabbit ear for taking blood, spay-neuter models, perfect for once you've got those basic surgical skills to work on a mannequin like this before you go on and work with animals in the clinic. And of course, you have the chance to really practice and practice and practice again with such models until really you have the confidence and the competence to go on to the next stage. And that's something that both you and the teacher will be assessing. But you do have the opportunity to focus on what you're doing without the confusions and complications and so on that are an animal experiment with its ethical problems and the stress associated with it will help impose onto the student in the practical class. So you can focus on things without extra complications and distractions. And I think that's very, very important, as well as the specific technical skills you have to master too. We talked about cost. The Sindava canine is expensive, but very good. There's also some very, very inexpensive tools you can use. In software, there's freeware, there's very inexpensive software, but also in terms of models and mannequins. And this is an example from the University of Copenhagen, the Surgical Skills Lab, where toys from a toy shop or a supermarket are bought, are then dissected, and various very low-cost materials are inserted into the body so you can have a low fidelity but sufficient fidelity model based on a toy, on rubber bands, on balloons, on condoms, on mayonnaise, for a wide range of different processes and procedures that you can practice. So anesthesia, for example, or how to approach a dog for a castration, how to hold the cat, and so on. So there's a lot of different things you can do. In this case, you can see double ligature, a ligature with an orchiectomy for the dog as well. So absolutely fine to use low-cost materials, and together with other materials, you can meet all the teaching objectives very effectively. This is another example of homemade low-cost materials from Brazil. And going back up to the more expensive materials, the Sindava human and the canine. These are stills images from our film. We'll also be making available lots of stills images and video clip excerpts from the film into a database so that you can use those materials yourself if you want to use them. And what you also have the opportunity to do with this is to have the mentorship, the guidance, which is so important with that surgical training. The human models, very, very different and very wide range of different options available there. There's more money in human medicine than animal medicine, so often there's a wider range of mannequins, but there's a lot for critical care and many other fields as well. I mentioned processes like anesthesia. You can practice that, intubation and anesthesia. And on the right, you can see another professor from Cornell who's developed critical care Jerry, the dog mannequin from Rescue Critters, and has added a heart pump and other apparatus so he can create simulated scenarios based on case studies of animal patients where students have to assess the dog, diagnose the condition, and perform some treatment. So 2 students will be in the room here with the simulated dog. Other students will be in the next room, and the teacher will be controlling the scenario with a tablet. So this is like a sort of homemade model built on a bought mannequin. And what this is for sort of clinical pharmacology and other areas. But what's valuable about this is that the students get the chance to experience these emergencies and other situations while other students are watching from another room, and then everyone gets together and discusses what happened and what could be done differently in a very non-judgmental and inclusive way. So very valuable, I think, and then people swap over. So a lot of things can be done from bought models or from items you make yourself. And of course, there's a growing number of clinical skills labs and surgical skills labs being developed around the world particularly within veterinary medicine at the moment. So these are now typical ways of doing things for small animals and large animals. Now, we don't have so much time, so I will work quickly through the last parts of the PowerPoint. The next type of alternative is the clinical experience with animal patients. Of course, in human medicine, you have a much more extended and apprenticeship model with interns and residents and so on, and specialization at the same time. In veterinary medicine, you need to know pretty much everything, be very competent upon graduation. So this is one reason to think about the curriculum, think about teaching objectives and the range of tools that can help you master those skills and gain the knowledge more effectively. So apprenticeship and looking at case-based work with patients, I think, is very important. A lot of opportunities for students to go out and help work in shelters, doing community medicine, doing other activity where you're really helping animals in broad society, as well as helping the companion animal guardians and the pet owners in low-cost neighborhoods, for example, in other countries, in areas where there's limited resources. But also, of course, working in private clinics, working in teaching hospitals. And when you can have the opportunity after you've gained sufficient skills on non-animal methods, then gradually being apprenticed under supervision into doing clinical and surgical work in the clinic with patients is a very, very valuable way of gaining skills and developing your confidence. So there's a lot of opportunities there. Many students who've had this opportunity are just so much more prepared for entering into the professions than those who either did animal experiments or had very little hands-on skills at all. So a lot of outreach opportunities. And the other thing that's very important about this is that it teaches you caring as a clinical skill. Sometimes the emotional realm is dismissed or is seen as a marginal thing, but actually caring is a clinical skill. It's an essential skill. You're more likely to diagnose correctly, to be up to date with the field, to have better treatment, to make sure that you have better recovery and post-operative care. It's all crucial. And I think alternative tools and approaches can support the development of this skill. Animals can also be volunteers, so they're not coerced into any practical class and they don't suffer in any way, but they might get rewards like interaction and food. And as soon as they evidence any discomfort, you would stop the practical class. Body painting of horses with non-toxic paint is a very good way of understanding anatomy and biomechanics, and that's an example there as well. You can do experiments on yourself. That's good for medicine and veterinary medicine, as well as biology. Nerve conduction velocity experiments, for example, like in this photograph, using the BioPAC student lab. You give a minor electric shock, you look at the nerve response, and you can analyze that. It's a non-invasive way. There are ethical issues, which of course you need to sign a waiver for, but very commonly used within human medicine: exercise physiology, respiratory physiology, analysis of urine, drinking coffee, and so on. So pharmacology too. And often in combination with software, this is a really excellent partnership, understanding the principles, using the software and other methods, and then applying it in practice with the real living mammal, human or animal. And I think these are very, very good ways of understanding physiology and applying it. For medical students, of course, you have the appropriate reference object, the human body, but this is also valuable for veterinary students. And it's often fun rather than a traumatic and stressful animal experiment. Traumatic and stressful for you and damaging for the animal. You can actually have a good time, and that you're more likely to have a better learning environment and learn better as a result. You can work in vitro. Sometimes you can use plant material instead of animal material. For cell respiration experiments, mitochondria can be sourced from turnips, potatoes, beet, instead of rat livers from killed rats. But you can also use human material or animal material that's ethically sourced too, and preparing students for a world where in vitro technologies are growing so fast with organs on a chip and organoids and so on, I think is very important. So a chance to practice this at in your higher education is good preparation for humane science too. And finally, ethical field studies, getting out of the lab into the field, good for wildlife biology, wild animal, veterinary medicine, and other areas, but also looking at animals within cities. You can often see animals in their ecological context, and of course there are ethical issues here for which our policy would apply. So ethical field studies out of the lab into the field, valuable as another type of alternative that doesn't involve killing or harming. So that is the sum of the types of alternatives that exist and that can be built on. And we can see, I think, another myth here, that using alternatives means you won't have hands-on experience of animals, where of course we need to ask, is it relevant? Are you going to be working with animals in your career? Veterinarians, yes, that's the case, but not every biologist will, and certainly no medical student will. So is it relevant? And then recognizing that replacement can also involve animals, as I mentioned, ethically sourced animal cadavers and clinical learning opportunities. So moving on towards the end, we can reflect on teaching objectives and the broader impact of alternatives. Standard teaching objectives can often be met more effectively using alternatives. When you audit a course and identify those objectives and the ones you want to meet, you can think about which tools to use in work combinations. So you can acquire knowledge and skills and attitudes more effectively, as the published studies demonstrate. Many studies are comparative studies, but there's also a lot also looking at the development and implementation of different tools and how they're benefiting students and teachers with better results, with greater confidence and competence as well. So you can see more studies that demonstrate how standard teaching objectives can be met more effectively. But you can also meet new objectives, ones that curricular redesign or the innovative tools can provide that you didn't manage to do before. New procedures, for example, new surgeries, ones that you can master better, dealing with stress, dealing with an emergency and doing that before you work with a real patient, and developing caring as a clinical skill, as I mentioned before. So you can meet additional objectives too. You can also overcome what we call the hidden curriculum, the implicit lessons and messages that are often negative that a certain tool, such as animal experimentation, will impart to the student, such as habituating you into instrumental use of animals, teaching disrespect, desensitizing you, and teaching conformity rather than critical thinking. So alternatives can obviate, can remove the negative hidden curriculum. Life science philosophy too. Biology is the study of life, I think is important to remember. Medicine and veterinary medicine as healing arts and science. Critical thinking as an essential skill. When you use alternatives, you're more likely to be encouraged, to be rooted with these deeper messages and these deeper ethics. Emotional literacy as well, emotional awareness and skills such as compassion and empathy, competence, recognizing that desensitization can stunt this, and giving an opportunity to continue to grow personally and professionally. And the same with ethical literacy, the importance of being ethically rooted and competent, that you can identify issues and find solutions, something that you're going to be practicing a lot in the professions too. So again, this is also a process where you can grow too, and using alternatives, being open about the issues, solving the solutions are all examples of defending and helping to develop ethical literacy in the student too. When you use alternatives, you can be more accessible. You're not discriminating against individual students or those with religious or deeply held moral beliefs. So therefore you're more inclusive, which is what a lot of universities claim to be in their education. You're less likely to be a teacher who pushes for a student to go against their conscience, or even risk a court case against university for denying civil rights. So it's a civil liberties issue too. But you can also develop your personal and institutional reputation when you are using and developing and implementing alternatives as a teacher or as a faculty as a whole. So the benefits there can be quite great. Certainly the body donation program at Tufts was something that started to attract students, knowing that animals were not killed for anatomy as a result. Animal freedom, of course, animals not being harmed or killed anymore when you're using alternatives. A more positive ecological impact that goes beyond the education into human and animal health care in society, and economic benefits. Not only can teachers be making their own alternatives and selling them, but often the alternatives are money-saving approaches. Some, like virtual reality or the more expensive high-fidelity mannequins, might be expensive, but they're also investments, and the benefits can be seen over time, as well as the costs gradually covered. And legislation, regulations, and agreements. Most laws state that alternatives should be used wherever possible. It is possible to be using replacement alternatives, so harmful animal use should stop and the humane innovations need to be implemented. So we can give a few examples here of work that we've been involved with, working with the German group Doctors Against Animal Experiments to help replace, by signed agreement, department by department, many animals in the Ukraine. So about 50,000 animals no longer used every year as a result of these agreements. At least 10 million, if not double that amount, animals replaced in India once the centralized body dealing with the curriculum in zoology agreed to stop zoology dissections, and we were happy to play a role in pushing for that change too. So very large numbers of animals where you have large countries, and very big impact when you can get to the center of decision making when centralized decisions are made. Often, of course, it's individual teachers that are making the decisions, and there's lots of opportunity there. But sometimes in some countries, things can be centralized, which take more time to happen, but then can have very rapid effect once they begin. And there's also been widespread replacement in Brazil, including in veterinary medicine, following a normative resolution that stopped a lot of animal experimentation. So these are just some examples of things we've been involved with, and there's a lot of change happening all over the world, much of which we don't know about, but we can certainly see the changes happening in terms of the replacement that's achieved. So briefly on the resources we can offer. We offer information, our former book From Guinea Pig to Computer Mouse, which you can download from our website. The documentary film you've seen an episode summary of, and a case studies book for next year. Our website with its databases. These include an alternatives database, a studies database, and the video database that we're creating at the moment. The alternatives database has over 1,000 items, and from the name and description to further content, you can find the producers and the distributors, and you can filter and search. So here's a stills image from at the beginning of A and B, just for clinical skills and surgery and models. And you can click on each of those and get the full information with the link to the producer. The studies database has over 1,000 studies, references and abstracts, and some PDFs. You can also message us and we can send you the full PDF if you can't access it directly. You can filter and search, including for papers that we've published as InterNICHE or with our colleagues. There's comparative studies, studies on the development and implementation of the tools, and on the use of technology in education and training. So here's the stills image from the beginning of A of the studies. And you click on, you click on that one of those and you get the reference and abstract with a PubMed link to. We also have loan systems. You can borrow items from us. We have a Canadian loan system and an international one, and ones elsewhere. So you can borrow Jerry, for example, critical care Jerry with his breath sounds and heart sounds. Sometimes we have small grants and freeware. We support students who conscientiously object. We go to conferences, do outreach and offer training at times. And you can also find other resources around virtual physiology for the SimNerve, SimMuscle, and other programs, virtual laboratories I was talking about earlier. And it's worth thinking about collaborating between different disciplines and looking at different people's skills. So software that might involve physiologists, graphic designers, and programmers, but also thinking between medicine and human and veterinary medicine. There's also a lot of areas where people can learn from each other and think about collaborating. There's also other information resources available, including the journals ATLA and Altex. And there's about 1 more week to apply for the Lush Prize, for which rewards retrospective development in the process of replacement, including in education and training. So you can go to lushprize.org for looking at that. And so in conclusion, we believe that alternatives are superior to harmful animal use on multiple levels, that 100% replacement of harmful animal use is indeed possible, that there's a diverse range of tools and approaches with alternatives for all practical classes, that there's a growing momentum and success here, with alternatives now often seen as the norm, and that we're really talking about win-win solutions, multiple positive impact, including sustainable development of replacement and of humane innovations. So students benefit by having access to superior learning tools, innovative learning tools developed through thinking about teaching objectives. Teachers benefit by being able to pass on their knowledge and skills more effectively. The professions benefit by having people who are better trained and critical thinkers entering into them, and society too as well, where those professionals will live and work. And of course, the animals benefit as well. They're not being hurt, they're not being killed anymore, because all the education can and should be fully humane. So thank you very much for listening, and apologies for overrunning a little bit on time. You can contact me on these through these methods, email and through our website. But now I'm very happy to pass back to Crystal, who can coordinate any questions in the little bit of time we have left. So thank you very much.
Yeah, thank you so much. And if you have any questions, please post in the chat. There aren't too many questions. Barbara just asks, is there anyone looking into the consumptive use of animals in veterinary CE courses, continuing education courses? I notice a lot of these classes, such as endoscopy labs, being offered at veterinary schools and veterinary conference venues, and never see any discussion about sourcing, nor do the sponsors ever provide sourcing information, which is concerning to me. I mean, I always ask and they usually tell me, but do you have any thoughts on that too? Just these.
I know that the Sindava at Cornell, the Sindava labs are also available to professional vets who can come and sort of refine their techniques and just improve some of their techniques and procedures, or to learn new procedures. So I think some of the more advanced mannequins are certainly available for that, and universities do sometimes offer those continuing education classes, often in state veterinary events, for example. But I think there could be a lot more opportunities, yes, for professionals to be doing continuing education with tools like this. The tools are also available to be bought, of course. You could use them yourself, but I think linking up with universities offers a lot of potential.
Mm-hmm. Yeah, excellent. Such good information. Not very many more questions or any more questions, but everyone, if you please fill out the survey that I linked in the chat, and that's how you get your continuing education certificate. And then this will be posted on our YouTube channel as well, which is linked in the chat. And it's also linked on ouronor.org. And if you go to the About section, you can find our YouTube channel. But thank you so much for coming, Nick, and telling us about these great advancements. And there's now no excuse for animal harm in education. So thanks so much. And yeah, you all have a good day, and thanks for coming. I'll see you all next time.
Thank you, everyone. And thank you to Crystal and Our Honor. Goodbye.
Thank you. Bye.